As a Christian, we're called to be the hands and feet of Jesus to those who are less fortunate.
We have the best healthcare system in the world for those of us who can afford it. We expect these vulnerable patients to come to us to adapt to our system. We can no longer do that. We're learning that we actually need to reach out to them.
So the Health Ministries program at St. Elizabeth Healthcare is a community outreach where we work with faith-based initiatives to provide health and wellness.
Those who probably don't have the ability to reach out and ask for help, we want to reach them so that they don't have to ask for help.
I was homeless living under the bridge over by U.S. Bank Arena. When you're homeless, you be depressed and when you don't think people care about you.
We're on a fixed income. It's me and my daughter and 2 grandsons, and money don't go as far as it really needs to go. What do? Food for the kids or medicine? So
it wasn't so good before I started coming here, but now that I've been coming here and getting treated by the nurses that's here, my life's basically turned around.
After you have a stroke, you think your life's over with, and it's not the case. She's nice, very nice. Takes me places, the doctor's appointments. I've met her daughter, I've met her husband. Even got a pair of shoes from her husband.
As a Catholic healthcare facility, we treat every person as a child of God, and it extends beyond our physical walls.
I believe that the work that I see faith community nurses do is incredibly important. We have amazing volunteers who are out working in their faith communities and community sites. The volunteers are the heart of the Health Ministries program.
I love the relationships that we form with our patients. We work with them closely, to help learn about their barriers and their obstacles with healthcare and with their access to healthcare.
That helps you take care of yourself when you think people care about you. I think they put like 10 years on my life, and that's a beautiful thing.
Well, before I had people tell me that I wouldn't be able to do this, do that. I'm basically showing them that I am able to do it.
It's a family that I didn't have.
He's gone from just surviving to actually living.
I want to get to a point where I can afford to give back, because I've received so many things that God has blessed me so greatly.
Frequently I hear people say how this has changed my nursing, and I know it's true because it's changed who I am. That's why being a faith community nurse is such a perfect fit for me, as I truly believe in physical, emotional, and spiritual care for each individual.
I love coming to the community, coming to where these people are. It helps them know that I'm not just at work and there to take care of them there. I'm right here for them.
Right here feels great.
It is absolutely a program that lives out the mission, the vision, but more than that, the heart of St. Elizabeth Healthcare.
I'm proud to be a part of an organization that is here for a purpose bigger and better than itself.
It gives me hope for the world, that it's all God being manifest here on the world, working to help the neediest people, the most vulnerable people in our community.
In a perfect world, the future of Health Ministries would be a community that didn't need Health Ministries, because we've been able to touch each and every individual who needed the services.
9,500 people were seen last year, cared for, and there's more to do. Our sisters and brothers are suffering and in need. We need to continue to be there, and even in a bigger way. In Matthew 25 it says, "Then the king will say to those on his right, 'Come, who are blessed by my Father, for I was hungry and you gave me something to eat. I was thirsty and you gave me something to drink. I needed clothes and you clothed me. I was sick and you looked after me.' Then the righteous will answer him, 'Lord, when did we see you hungry and feed you, or thirsty and give you something to drink? or needing clothes and clothe you? When did we see you sick? The king will reply, truly I tell you, whatever you did for one of the least of these brothers and sisters of mine, you did for me.